Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to the Compliance Divas podcast. I'm Mary Gavoni, and I have a very special guest today, Debi Karr, who is an expert in all things HIPAA and HIPAA security. So we're going to spend some time discussing where we're at, what's the state of the union for HIPAA security, and what we need to look toward in the future. And Debi, let's just start off. Will you give us just a little bit of an idea about your background, how you got involved in doing HIPAA consulting? Because most people would look at you and say, oh my gosh, how can you stand to do this?
Oh, well, I love to do it. So my name is Debi Karr, and I'm with DK Karr and Associates, and we are a cybersecurity consulting firm. How I got into this was actually my husband is into computers, and you cannot be into computers if you don't have some security with it. And so I was in technology and computers because of my husband. And then I went to work in the dental industry. I actually worked for a periodontist. And because of my technology thrills, he let us put in whatever technology I wanted. So we literally put in a digital pan in 2002 when it was kind of unheard of, and we went paperless in 2003.
Wow.
So because we were a perio, we would have open houses, and in 2009, 2010, when there was really a big push for doctors to go paperless, I started consulting, helping doctors to implement paperless practices. And my husband said, honey, that's called consulting. People get paid for it. And so I took it and ran with it, helping doctors to go paperless. In 2014, I had a health issue come up and had lots of reading time. And as you know, the HIPAA rule became HIPAA high tech in September of 2013. And I'm a nerd, so I actually spent my time reading and realized that the HIPAA laws had changed. And the doctors were not going to know what to do or how to do it. And because of my background in technology through my husband, I knew how to implement it. So I was on leave and I basically told my boss, you can term me because I'm not coming back. And I went this direction. We help doctors to meet compliance by conducting their risk analysis. We also help when there has been a cyber breach, a data breach of any kind, to navigate through all of the laws, rules, regulations, because you've not only have federal, but you also have state rules. And it's not just where you practice, it's where your patients are. So there's a lot of things. Plus, we want to get you back up and running. There's just a lot of, I call it a juggling act of balls in the air at one time, simultaneously happening to meet all those things. So we help them to do that.
Fabulous. One of the things that I'm sure you experience as well as I do is that many dental practices just don't see themselves as vulnerable to some kind of a breach. They take a lot of risks. They're very,
Struggling.
for lack of a better description, loosey-goosey about security, and the risks are getting greater and greater and greater.
Oh, we just in 25, we saw a 234% increase. Now, the good news is the ransom payments have decreased, but the attacks have increased 234% just in 1 year. Now we have seen, of course, I don't have the actual statistics, but we have seen an uptick in attacks in the last 8 to 9 weeks, per
Mm.
se. You know, a lot of times what's happening around the world influences what the attacks look like. We know that a prominent dental payer was also compromised. So now a lot of practices today are wondering, are they going to be able to get payments because this payer has been compromised. And what people don't realize about that is now these hackers, and we know that the hackers have this information because they've already posted it. And so, and part of the information that was posted is client information. Or so now we have the two MSPs that also their information was posted, their client information. So those MSPs information about their clients, who are their clients? Those doctors
Right.
are now on the dark web. So these hackers don't have to do a lot to get into the practices. And it is always mind-boggling to me that dentists are so lax that they just think it will never happen to them, when in reality, they are the gold crown jewel because they have the most information. What is this about? It's about collecting money, and it is about being able to sell because they collect the money from the practice. Now, it used to be they just collected it from the practice. Now we're seeing double, triple, quadruple extortion happening. And so, they want the money from the practice, but then they also want to be able to sell that information because we have a lot of people that want to impersonate other people. We know that. We know it, our information's for sale. How many spam calls do you get a day? Where do you think they're getting those numbers? They're just randomly choosing your number? No, they're buying it from a list because
And
your information's on the dark web. Thank you, Equifax.
right. And aren't some of those hackers actually going to the patients directly as well?
Oh,
Have
yes.
but I
Yeah,
want to backtrack just a little bit, just for our listeners who may not know what MSPs are.
managed service providers.
Okay,
Those are
just
your
want to clarify
IT.
that
Now,
for them.
unfortunately, what we see so often is that practices are still using IT. So there's two things. There's IT, and then there's a managed service provider. A managed service provider is doing just that. They are managing your entire network. Yes, that bill is going to be higher every month because they should be managing your hardware and software which within your practice. Unfortunately, I am still seeing a lot of doctors using IT. Yes, they're paying a monthly bill, but it's only like $400 or $500 a month, which means they've put a firewall in an antivirus, but they're not managing your network. And when they do manage your network for everything they do, there's an extra cost. So what happens? Doctors don't want to do that extra cost, so they either don't do anything about it or they try to fix it themselves.
Mm.
And so where with a managed service provider, that it would be a call and that goes back to on the managed service provider and we don't have to worry about it. But a lot of doctors are still using the IT, which we call break fixed as needed. And so we don't really have control of what's happening in the network.
Okay, so if I'm understanding you correctly, what you're saying is simply using an IT support service is no longer enough
Oh
for these
no.
practices.
Oh
Okay.
no, not
All
enough.
right. Okay, well, that's good to know. So let's talk about where are we at? We've heard all this information about new rules and new requirements coming in from HIPAA. Where are we at with that?
So we are expecting an update HIPAA security rule. So first, HIPAA has three areas, and HIPAA is enforced by the Office of Civil Rights because when our information is violated, it is a violation of our civil rights. So, and they are under the Department of HHS. So we are expecting an update to the security rule any day now. However, it's already here because HIPAA High Tech went into place in 2013. And what it says is, first of all, that you will conduct a risk analysis. So every practice should be conducting a thorough, the key there is thorough risk analysis to determine any vulnerabilities that, if exploited, could cause damage to one or more individuals. The second, so HIPAA has three areas. It has the security rule, the breach rule, and the privacy rule. So in my world, as a cybersecurity consultant, the security rule are the methods, protocols, standards that we use to protect the privacy rule because we don't want to have the breach rule. So security is the first part of the HIPAA rule. You will conduct that risk analysis. The second item is that you will have a security management plan in place. That is everything else that's in the security rule. Now, we have seen through enforcement what that looks like. In 2024, the Office of Civil Rights started what they called the Risk Analysis Initiative, and that was because practices from hospitals on down, and that's covered entities and business associates. This is something that a lot of these people miss. It also applies to your vendors, your business associates, your business partners that are touching your information. They have to meet the same standards as well. Okay, so they started this risk analysis initiative, and what it says basically is if you haven't conducted one, you are in violation. End of story. In April of 2026, they expanded that initiative, and they are saying that if you cannot document that you've had a risk analysis in the last 12 months, because when you are in cybersecurity, that is required. Every 12 to 13 months, we are conducting a risk analysis. And actually, a risk analysis should be an ongoing process because, and then you get into what types of risk analysis you're doing. There's qualitative, there's quantitative, but you've got to have something at least for 12 months. Hospitals, they need to be doing high trust and they're doing it all the time. Small practices, at least every 12 months. And have a documented security management plan. And OCR, the Office of Civil Rights, has a standard. And that standard is what is called NIST, the National Institute of Standards and Technology. So you need to be using a NIST approved security management plan in your practice. Otherwise, it is seen as willful neglect. And they announced this in April, they are going to start fining as willful neglect. Now, when you look at those fees, that is $75,000 per record. How many records do you think the average office has?
I would say probably 2,500.
Fortunately, there is a cap of 2.5 million, but we both know OCR likes to make it hurt.
Sure.
They don't want you to go bankrupt, but they want to make it hurt. I had one client that was hit with ransomware. Fortunately, we did not have any fines and penalties. We got past that. We were able to implement some plans at the time. So when the breach initially happened, they were using an online risk analysis, HIPAA compliant program. So they had a little something in place. The plan that we implemented with them satisfied OCR. But now they're saying if you don't have that at the time of the breach, it's willful neglect because these laws have been in place since 2003.
Exactly.
So they don't have to change anything. It's already there. Some other subtle hints that they've been giving us, however, is you may remember in 2024, NIST sent out the revised 866. Now, this is a document that most practices are supposed to use for implementing security in their practice. And what that aligns with is what is known as the cybersecurity framework. They also, I believe it was around January of 2025, released the cybersecurity goals, and it had the essential and the enhanced. And fortunately, all my clients were already in the enhanced because I've been using cybersecurity framework with my clients since 2014. So my clients were already in the enhanced, and they have a very solid, documented, ongoing plan in place with no problems. And that's what OCR is looking for.
Mm-hmm.
Because otherwise it is willful neglect. If you don't have those things in place, and this is what's so infuriating, is that this has been on the books. This is nothing new. But doctors are so worried about how to protect their investment but they don't look at implementing security. I can't tell you how many. Well, I had a client that was hit with ransomware, and they looked at me and said, "Was there something I could have done to prevent this?" Yeah. If you had done a risk analysis like HIPAA says you should. If you had a security management plan in place, like HIPAA said you should have. And, part of that plan is having a sanction policy. You would have recourse against the employee that caused this. But you know what? If you don't have anything in writing, it did not happen.
Yeah. That's the scary thing that, when I talk to clients and ask them, have you done a security risk analysis? And the answer usually is, what's that? They don't
Right.
have a clue.
And
they
the
don't.
reason, yeah, and the reason for this is because there are a lot of experts in the privacy rule, and
Mhm.
that is what is taught.
Yes.
Everybody by now should know, don't talk about your patients in the waiting room and don't talk about your patients at Panera Bread. Everybody should know that.
Right.
But we're not being educated. We're not educating doctors on the security rule. And it's crazy. And I don't understand.
Well, as I said before, and I think there's two factors in this. One is because they don't understand, they do not understand their vulnerabilities, and they don't understand the technology. I think the attitude of a lot of practice owners is like, oh, it's not going to happen to me, so I don't have to worry about it. The other is the financial ramifications, meaning, oh, I already pay so many fees every month for software programs and all these things. It's just one more thing I have to pay for, and I don't see any direct benefit from it.
Well, let
And
me
I
give you the
think that's
direct benefit. When you have to take $450,000 out of your 401k to meet all the expense of a ransomware attack, that investment just has a whole new meaning.
Oh, absolutely. And then there's the other misunderstanding is that, well, if I buy a cybersecurity insurance policy from my insurance broker or from my dental association, it's going to cover everything. And they don't understand that if you're not doing what you're supposed to be doing in the first place, they're not going to pay.
Right, because I actually have had that where the insurance company denied benefit because well, first of all, in that case, it was several years ago when basically it was two questions. Are you HIPAA compliant? And that was it. And she had answered yes, she was HIPAA compliant because she had done her annual HIPAA training, so she was good. But when they started asking for her risk analysis and all of her documentation, and she didn't have anything, they said that she had fraudulently filled out the application that
Yeah.
she was not HIPAA compliant. Nowadays, however, the questionnaires on the cyber policies are 2 and 3 pages
Yes.
of questions. And so we're seeing that the insurance companies, they want to know that their risk is being covered. And again, we've got to go back to those subtle hints that OCR has given us. We've got the new 866, which is how to implement a HIPAA security plan in your practice. We have the cybersecurity goals and essentials and enhancements. We have the video from April. They're telling us very boldly what these new things are going to be. Multi-factor authentication. If you're not using multi-factor, and especially as we're moving to the cloud, really
Yes.
use multi-factor authentication on everything. Oh, yes, I realize that it takes an extra 22 seconds. 22 seconds.
I
Believe
know. I
me.
fight with them all the time about that. Oh, it takes us so much longer. No, it doesn't. Time
Sha-
yourself.
Shared credentials. Well, it's gonna, our assistants are hopping. Okay, your assistants are hopping in and out. You are no busier than a hospital. And oh my goodness, I have recently had occasion to spend a lot of time in hospitals because I'm in parent phase. And they walk up to a computer, they log in. They walk out to leave a computer, they log out. They leave the computers all over the place, but you know what? They're able to do it. And if you're really good, I bet you can type pretty quick and get in 10 seconds or less. Seconds matter. Seconds count. In 10 seconds, a hacker can be in that system. So use that multi-factor authentication. We know that they're wanting the risk analysis and they're going to want the vulnerability scanning or pen testing. We actually do pen testing
Okay.
and vulnerability scanning.
Right.
So for our clients, we've been doing that since 2014.
So,
We've been
and
doing
again,
the
just for clarification for our listeners, pen testing is penetration testing.
penetration
Yeah.
testing. Yes. So we basically hack your system from Florida. It's fun.
Yeah.
Because I have hackers. They are ethical hackers. Wouldn't you rather have an ethical hacker hack in and get into your system versus somebody who wants to extort, kind of thing? And this is part of it. You're supposed to know these things because if you're not doing these things, then you're prioritizing profit. And this is what I told this doctor that asked me, was there something I could have done? Here's what doctors do. They either don't go to there's meetings where everybody's speaking, and they either don't hear it because the speaker is talking about privacy and not talking about security. That is a huge issue with a lot of the meeting planners. They don't want to go to the course because it's better to go to an all-on-4 or something else, and they send their office manager. And when the office manager goes back and says, we need to do all these things, oh no, that's going to cost us too much money. We're not going to. That's the key. They'll go to a course that's going to make them money. You and I should be one of the busiest consultants around. And the reality is doctors don't use us because, wait a minute, it's going to cost me money to implement all the things that you're saying I need to do, and I got to pay you. Oh, no, I'm just going to not do it and take my chances. And that in itself is accepting the risk. But I can tell you that accepting that kind of risk is very, very expensive. And another thing that dentists need to be aware of is up until 2020, they could kind of skirt under the rug. They could kind of skirt under the radar. But in 2020, dentists were raising their hands saying, we're part of healthcare. We should get to work. And now the government is saying, oh, yes, you are part of healthcare. You are right. We're going to let you work. Now, before then, if you had said, is there a possibility of me being part of the random audits that OCR does? I would have said no, not at all. Most dental are not CMS or Medicaid providers.
Right.
However, times have changed. Now, dentists have admitted that they are healthcare. Two, many, many practices are now under CMS without realizing it because they are accepting the dental out of Medicare Advantage plans. So now they are on that radar. So what are the chances of a random audit now in a dental office? Very high.
Much higher.
Because what they do is they take subsets. We're going to audit 50 internists, 50 cardiologists, 50 ophthalmologists, 50 dental offices.
Yeah, it's scary. Well, and if you go to the Health and Human Services breach portal, which they used to call the Wall of Shame, you can see a number of dental practices listed there. I
Oh, yeah.
show that if I'm lecturing, I show them. It's like, this is not limited to other areas of healthcare. It's just that the numbers in a medical setting or a hospital setting are larger than what they are. But my perception has always been that because it's known to these bad actors that dentistry is not very secure, that we're like the low-hanging fruit, easy to
Very
get
much so.
to hack into. So one of the things that we obviously need to overcome is the belief that it's not going to happen to them. And one of the changes that I've read about is that in the original HIPAA security rule, many things about encryption and other requirements were considered addressable, which meant that they weren't mandatory. But my understanding is that when this new rule officially takes effect, everything is mandatory, correct?
So let's yeah, that is, and technically it already is. Okay, again, we are seeing regulation by enforcement. Okay, so let's go back. HIPAA was written, the HIPAA High Tech Rule came out in 2013. In 2013, encryption was expensive. It was in order to do encryption, you had to buy special software.
Yep.
You had to you had to back up everything that you wanted to do. You had to deploy this software. It was a very cumbersome and expensive thing. Now everybody should be on Windows 11. And with Windows 11, it's a toggle. So the argument that it's expensive is gone. So now OCR is saying that is no longer an excuse. You have to do it because it's easy to do. And again, as we go to the cloud, why would you not want your server should have endpoint full disk encryption, but your endpoints as well. Why would you not, especially if you're totally cloud, why would you not encrypt the computer that you are using to access the information? Mind-boggling.
It is. It is.
But
Well,
yeah.
let's talk a little bit more about risk analysis. In the last year, the Department of Health and Human Services has updated, and I personally think upgraded their security risk analysis tool. Is that something that you recommend, or do you have other sources that you recommend for risk assessment?
Because I'm certified in cybersecurity, I don't use the SRA tool, and even the SRA tools tells you that this may or may not hold up during an investigation. It is a good place to start.
Okay.
I do recommend to, at least start somewhere.
Okay.
However, there's a lot of things. First of all, what are you analyzing? So you've got to go through, there's got to be some pre-analysis steps. What exactly are we analyzing? Well, in order to know that, you've got to know what devices you have. What are your assets? So one of the things that we're going to see is, do you have a master inventory list?
Right.
And that is, an asset is anything you pay for. So that is your hardware and your software.
Okay.
So those software licenses. Where's your information created, transmitted, stored? Have you done data mapping? Do you know who outside of your company, outside of your practice, is touching your information? So you've got to have data maps. You've got to have master inventory lists. You've got to have a process for adding and subtracting from that. How often are you going through that list and updating it? What is the process and life cycle? That is another area that a lot of doctors, they think because it's not broke, we're not going to fix it. Well, now that we've gone to Windows 11, we still have a lot of doctors that are still having to use Windows 10, not because they want to, but because the technology that they're using did not update and won't work on a Windows 11 device. And so, yikes, now what? So now we have to do some workarounds. So this is where that technical knowledge that fortunately I have because of my husband comes into play, where we can do some workarounds. But it's mind-boggling to me that doctors don't want to see. I guess they think that if they don't know, maybe, I don't know. But a risk analysis is something that should be done on an ongoing basis. We do what we call a point in time. So we look to see where we are at this point in time. But here's the key that a lot of practices miss. They'll do that SRA, but you have to have written policies enforcing every action.
Right.
And so one of the first questions I ask is, do you have a written formal security management plan in place? Do you have a security manual in place? And they point to either the ADA book with the shrink wrap still on it, which if they take it off, we'll tell them how to write a policy. The other one is they point to their employee handbook. One paragraph in your employee handbook that says we will align with HIPAA is not sufficient. They are looking for a regulatory policy. Have you identified what regulatory agencies you have to answer to? Everybody knows they have to answer to HIPAA, but what else? If you have a computer and you have patient records, now you have to answer to 21st Century Cures Act. What state are you located in? Are you on a border? Do you see patients in your state, but do patients from your state, like I recently learned that Utah is connected to Colorado, right? But, people in Colorado think that maybe the dentist might be a little nicer in Utah. It's where your patient lives at the time is the
True.
point. And so in the Carolinas, when you're on the border, it's not uncommon for us to head to South Carolina. Our mailing address is North Carolina, but we go to South Carolina for a lot of things
Right.
because we're 5 miles. It's
Right.
more
And I live in
convenient.
Kansas, and we see that happen all the time. People that live in Kansas City. Well, which side of Kansas City do you live on? The Missouri
Right.
side or the Kansas side? And yeah,
Yeah, we have borders for tax purposes, but not for
yeah,
driving purposes.
yeah.
So it's all these things to look at and to consider that they don't consider. And I guess the main thing is that this mentality that, well, we've always done it this way. Well, we've always done it this way worked then. But we wonder why we're up 234%. It's not that hackers have gotten smarter. They haven't. It's that we're still trying to do things. We've always done it this way.
We've done it the old way. So at least the SRA tool from Health and Human Services is a starting point for a practice who's never done a risk assessment before. That might be a good starting point. One of the things that I have seen in a couple of instances where I had some practices who were audited, they were cited for the auditor accepted at that point the SRA tool. This was a number of years ago, but what they said in the risk assessment was they identified certain risks, but they didn't do anything about it.
That's huge.
And so, yeah, so you can't go through the same risk assessment year after year after year and say, yeah, that is a risk, and not have a plan
Right.
for making it happen. And my advice is always, you have a detailed plan and you have timelines, and then you go back and you say, okay, we completed this. Otherwise, your risk assessment is not so valuable.
Exactly. And these are things that, again, when you go back to a security management plan and you have that formal plan, you should have a formal policy that says, and I get that it's hard to, because I was a practice manager, so I
Sure.
completely understand. There are a lot of things that in itself is a juggling act or many, many hats. Um, but take at least an hour a month and review your policies. Look at where you are. Look at what's happened. Have I made any progress? With our clients, we have mandatory calls with our clients just because we want to keep them on track. And we know that we're asking a lot. We are asking our clients to meet the cybersecurity framework. And we know that we are asking a lot and that they need the guidance. So we want them to be able to know where to turn and what to do.
Mhm.
And so it doesn't have to be cumbersome. And the thing about it is writing a policy is not expensive. It does not have to be expensive. There are some upfront costs involved, yes, but over the course of years, when knowing that you can go to bed at night and not have to worry about waking up and seeing a ransom note, because I can tell you, hackers have gotten to the point now where they don't even encrypt. It used to be we knew that we were in trouble because we came into work and all of our files were changed. We couldn't access our practice management. We had this dot da 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 after it. Everything was encrypted and only the hacker held the key. They don't even have to do that anymore. Because see, they changed, we didn't.
Right.
Now what they do is they just leave a little note and say, oh, by the way, we've been in your system for 49 days. We deployed a keylogger. We have all of your passwords. Yeah.
Yeah. That's a frightening thing.
And access control is going to be huge in the new rule. It's already there, access control. Why are we giving everybody administrative credentials? They
Mm,
shouldn't. We should keep the minimally necessary rule in place. There's a big, I don't know if you've seen, I'm sure you have. I've seen it where employees did something, and 9 times out of 10, they're doing it accidentally. They didn't intentionally mean it. But if we have the controls in place that one, they couldn't accidentally do something, but then let's talk about that 1% that we do have to worry about that might do something. If we had the controls in place, we would not be dealing with embezzlement. We would not be dealing with patients getting deleted, schedules being changed, money being put what places it shouldn't be put. All these things could be controlled if we had the proper security controls in place, but we don't do it. Security is about layers. It's not a one and done, it's layers.
sure.
We call it security in depth. We want it to be, if you get through the first hole, you got the second. I think of it as hurdles. You
Sure.
got to go through all these hurdles to get there.
That's a great analogy. And, I find that doctors in many cases don't even know how to access the audit trail in their practice management software. So that's another area where you can see what is going on, whether it is embezzlement or whether it's somebody logging in that shouldn't be logging in after hours, and all kinds of interesting things.
Well, that's where they go back to, oh, my IT handles. So the two
Yeah.
excuses I hear all the time about why doctors don't need to hire me is my IT handles my HIPAA.
Mm,
Well, no IT handles your HIPAA. IT, MSPs, managed service providers, they handle the hardware and software that creates, transmit, and stores your data, your information. They cannot make you compliant. No IT is going to tell you how to hire, how to fire. An interesting little tidbit. Cybersecurity is a huge word that people are using today and have no clue. So I was speaking to a managed service provider a couple of weeks ago that was trying to, we had sent out a proposal for my clients.
mhm.
And and it has a lot of questions, which you should be asking. This is part of your security management plan. Anytime you're talking to a vendor, you should not just be signing that BAA because BAAs don't mean anything. You say you're HIPAA compliant, prove it. So in order to prove it, we ask for a lot of documentation. We ask a lot of questions. So this MSP called me and he said, you're asking me a lot of questions I don't have to do. And I said, oh, yes, you do if you have healthcare clients. And well, I have healthcare clients and nobody's ever asked me that. Well, I'm sorry, but here we are.
Doesn't mean you don't have to do it.
Exactly. So we went through all this process, and because I'm asking, okay, so who on your team is certified in cybersecurity? There are a lot of certifications out there for cybersecurity.
Mhm.
There's the CC, which is certified in cybersecurity. It's a baseline. It's very uh, uh, entry level, but at least it's something. Security Plus, CISSP, HCISPP. Myself and Amy Wood are HCISPPs. And so, that is our focus. Anytime you have a true cybersecurity certification, you have to maintain continuing education.
Ah,
In those, like I have 2 certs and I have to maintain 45 a year in cybersecurity. So
wow.
going to a dental meeting does not count. It has to be in cybersecurity. No MSP is going to tell you how to hire, which is part of HIPAA, how to terminate, which is part of HIPAA, how to levy a sanction, how patient information is going to flow through your practice, how to release a record to a doctor, how to release a record to a dead patient's family, how to release. All these things are required under HIPAA. It's not anything new. All they're
Right.
doing is they're going to say, okay, y'all have had since 2003 to get your act together and you didn't know what to do. So now we're going to give you 1, 2, 3. But here's the clincher. Most doctors take credit cards in their practice.
Hmm.
There's this little agreement called PCI
Oh, yeah.
DSS. Guess what? Everything is required under the contract that you sign to accept credit cards. You will have a perimeter firewall. You will have unique user. You will have. So all HIPAA is doing is coming in line with what is already best practices in every other industry. If you are in retail, if you are finance, there's laws that guess what? Those laws, Sarbanes-Oxley, Graham Leahy, I have to know all those because of my certification. It's the same basic requirements. It's just we're talking about HIPAA. If I was
Right.
talking to a CPA, in fact, tomorrow I will be talking to a group of CPAs. Everything I'm telling you are the same. I'm just going to talk about their client information versus patient information.
Right. Exactly. And I'm so glad you brought up PCI because a lot of practices that I've talked to confuse PCI with a risk analysis. Well, yeah, we do that every year for our credit cards.
PCI is a contractual agreement. So they contract that they will do these things. This is
Right.
a signed, and this is another one of my little pet peeves is those business associate agreements. If they are not signed, they are not agreements.
Hmm.
They have to be signed by both parties. And there
Right.
are a lot of vendors out there right now that are giving BAAs, but they will refuse to sign them. They do not sign them. Or they charge my client $250, $100, $2,500 to have them signed. That is not the way this is supposed to work.
No.
And so that is an area. And as we move into AI, this is going to open a whole new can of worms. The notice of privacy practice changed in February.
Right.
So when we sent out to our clients that change, we knew that change was happening, but we also, because we watch what states are doing, because you've got
Right.
to answer to those states,
Right.
we know that there are multiple states. Colorado has just enacted it, where if you are using AI in your practice for clinical diagnosis or for payment, you have to make your patients aware. So in our
Yes.
notice of privacy practices, we've already put in there that we may be using AI, because
Yep.
what a lot of doctors don't even realize is these insurance companies are using AI to make the decisions on whether they're going to pay you.
Yes, exactly. And I've done the same thing. I've warned my doctors that they need to do that as well. So, and you're right. I think we're going to have a lot of issues that we're going to need to confront in the future with the utilization of AI. So let's kind of summarize what we've discussed today from everything that you have shared with us. And thank you so much, Debbie, for sharing your immense knowledge. Um, the risk analysis is sort of a key, kind of the hub in the wheel that, for lack of better description, that
Yeah.
these practices need to have and make sure that they have truly a managed service provider or an entity that can assist them with, as you say, the hardware and the software, but then they also need assistance with the policies and implementation and all of those types of things.
Well, yeah, it's so a risk analysis is just that. It's determining the asset value. You look at the exposure value. You look at the annual loss expectancy. So there's steps that need to be taken before you can conduct a thorough risk analysis of what your exposure would be. And that's the whole purpose of a risk analysis. And my fear is that this is going to become, oh, this is one more thing that we have to do. A risk analysis should be living, breathing. And as you indicated, once that risk analysis is done, there's mitigation that has to happen, because you can't continually say, oh yeah, we knew about it, but we didn't, we chose not to do anything. That is not going to be a good answer. When there is any kind of data breach. And what practices don't realize is handing the wrong walkout statement to somebody can cause a data breach. And I've got it happening right now in two different locations.
Mhm.
And so, do you have a policy that says to double check the patient and the walkout statement to make sure? If you don't, it didn't happen. So, a risk analysis is determining what your exposure could be if something happened.
Mhm. So it all starts there, and hopefully that's where you can identify where those issues are. Well, Debbie, thank you so much. I have the feeling we're going to need to bring you back again, probably a couple of times in the future,
I'll be
to
here.
give us your expert information. And so in the show notes for this podcast, we will include contact information for you in
Okay,
case our listeners would like to utilize your services, or if they have questions for you. And we will put links to the NIST 800 document and a number of other things that will be helpful for our listeners.
well,
Thank
thank
you
you
for
very
joining.
much.
Thank you. Thank you for joining us today for this episode of the Compliance Divas podcast. The Compliance Divas navigate the regulatory world to keep you on course. Please, at the end of your podcast app, leave us a rating or leave us some feedback. You can always ask questions of us by email to support@thecompliancedivas.com. And please subscribe to the Compliance Divas podcast so you never miss an episode. Thanks for joining.